If a nursing home resident falls out of bed that is at a regular height, there's a very good chance that he will suffer severe injury or even death. Now, not every fall will cause injury or death, nor will every prevention measure prevent a fall. But coordinated prevention measures for each individual resident can go a long way to preventing most injuries. Now, we're going to be discussing nursing home falls in the next few videos, but today I want to focus on when residents fall out of bed. It's a very common problem at nursing homes. You see, nursing homes have a responsibility to provide a safe environment for those residents, and that includes when their residents are in bed. They are required to do several assessments to determine what's the safest environment for each particular resident. And these assessments include things like whether the resident has the mental acuity for them to use bed rails, or whether the resident has a history of rolling out of bed, or whether the resident has insomnia and tries to get up out of bed in the middle of the night. Those are just some of the assessments that are done. Now, as a result of those assessments, they then put together a plan how to best prevent residents from falling out of bed. 3 of the best preventions, in my opinion, are low beds, frequent toileting, and the use of bed alarms. Now, I don't have time here to address all 3 of these in this video, so I'm just going to focus on low beds in this video. But be sure and watch the other videos because, for example, regarding bed alarms, there's a ton of controversy on that, and I want to address that. So a low bed is a bed that can actually be lowered very close to the ground, sometimes 7 to 12 inches from the floor. In combination with that, with a low bed, nursing homes will often put a cushioned mat next to the low bed. So why do they do that? So for a resident who has a history of or is at risk for rolling out of bed, a low bed reduces how far they fall, and when a cushioned mat is next to the bed, it lessens the impact of the fall. It's kind of a 1-2 punch there. Is that going to prevent every single injury that might happen if a nursing home resident falls out of bed or rolls out of bed? No, because nothing's universal, but it dramatically reduces the risk of injury. I see way too many cases where residents should be in a low bed, but they're not, and they suffer great injury or death as a result. So why aren't the beds lowered when it's for the benefit of the resident? That's a great question. I believe it's because it creates an inconvenience to the staff, but I might be too cynical. What do you believe?